You know, one of the most exciting and most frightening times in somebody's life is when they find out that they're going to have a baby. And there's so many different emotions, there's so many different aspects to consider. There's just an array of things that are going on in somebody's mind. And any help that can be provided to these women is obviously a plus. And Healthy Start Coalition is one of those groups that is always there for moms and babies here in Polk County. And here to talk to us a little bit today about Healthy Start Coalition and the Safe Haven for Babies program is Mary Jo Plews. She is the executive director of Healthy Start Coalition of Hardy, Highlands, and Polk counties. And Gloria Camacho.
Yes.
And she is the community awareness coordinator for Healthy Start Coalition of Hardy, Highlands, and Polk counties. Ladies, thank you so much for coming on today.
Thank you for having us.
Happy to be here. Thanks.
Now, when we talk about Healthy Start Coalition, like we said, you guys take care of so many different things, so many different areas. Just real quickly, what are some of the services that are offered by Healthy Start?
Well, Healthy Start really provides an array of services. Our main program is the Healthy Start program, which is provided by the county health departments, and moms can be eligible for the program based on certain risk factors that may lead them to have an unhealthy pregnancy or maybe have a low birth weight baby. And then once the baby's born, baby may be eligible for the program based on the baby's health status. So it's free. We provide services that are directly related to helping make sure that mom has a healthy baby, like breastfeeding education, parenting education, childbirth education, making sure she gets good prenatal care. One of our key services is a model of group prenatal care called Centering Pregnancy, which really research has shown helps moms have, on average, a baby that weighs a pound more and carry their pregnancies 2 weeks longer. So all of our services are tied to make sure that moms are healthy and that the babies are born healthy, with the goal of reducing infant deaths in our community. Along with that, then, we have additional initiatives like being the chapter coordinator for Safe Havens for Newborns, along with Gloria's help to make sure we get the word out there about that Safe Haven law that was passed about 13 years ago. And then in response to that law, a Safe Haven for Newborns nonprofit was founded by Nick Silverio, and they host a 24-hour multilingual hotline and provide support to women throughout the state of Florida, and actually has served as a model for other states to enact safe baby laws and to have other services and supports like Nick has created.
Right.
So in Hardy, Highlands, and Polk counties, again with Gloria taking the lead, we work really hard to make sure the community knows about the Safe Haven law. And I really like the way you started. When you find out you're pregnant, it's the most exciting time, also very nerve-wracking time. 50 to 60% of pregnancies are unplanned. Polk has about 7,200 births a year, so we're talking 3,600 to 4,000 births a year in Polk County are unplanned. So a lot of women are going to find themselves in that situation. Yeah. What am I going to do with this baby now? I didn't plan this pregnancy, so what's out there to help? Right. And Safe Havens is available to help women throughout pregnancy. So they can call the phone number from the time they find out they're pregnant and find out about services in Polk County to help sure that they get the support and the services they need to help them get through that pregnancy. Whether it's planned or unplanned, services are available, and Safe Haven is there to help.
Now, obviously, you know, what we experienced in the United States was a need for a program like Safe Havens. This law that was passed, legislators saw the need to step in and say, we need to provide an avenue. But what are some of kind of like the details of the law? How does it work? Who is eligible for utilizing the Safe Havens program?
Okay, this law allows parents or whoever is in a possession of a unharmed baby up to 7 days old to leave them in the arms of a person who works at the any hospital, fire rescue station, EMS stations. And basically, this process, it is done anonymously, confidential. So there's there's no fear of prosecution for that mother or that father or whoever is in that possession of that baby if they decide to leave the baby, as long as it's left in the arms of an employee at any of these safe haven facilities, as I mentioned.
Now, you had mentioned that it's for babies up to 7 days old.
Correct.
Now, does it have to be a last-minute decision? I mean, can you, as somebody who doesn't know what to do, you know, they're going into labor, you know, they're ready to have this baby, can they know ahead of time, okay, I'm going to use this, or is it something that really is just for that 7-day period after the baby's born? I mean,
well, the baby has to be the baby has to be 7 days old or younger. So
okay.
it could be done if
between birth
and up to those 7 days. Now, after we are still encouraging those parents that if the baby is older than 7 and you don't want that baby, then yes, still follow that procedure, but it will not be.
May have to go through an adopt or.
And it will not be now under the law, because
okay.
it has to be 7 days of age or younger.
So there's a different process after that 7
Yes.
days is established. You can still take the baby to a hospital, but there's going to be some different things that have to be done after that 7 days.
Yes, and the situation varies, because there is the spirit of the law, which is to follow all these steps, which is what is considered the law of the safe haven for newborns.
Right.
And there is the letter of the law is followed, and the spirit of the law.
Right.
Mm-hmm.
The spirit of the law is more of a compassionate approach
Right.
to that situation.
Now, the obviously, you know, the law states that you can leave the baby, and there's not really any other additional. It can be completely anonymous. But if a parent wants to leave information, how does that work? Or are they not allowed to leave any information?
They'll be encouraged to give like medical information. They don't have
Okay.
to give their name. They don't have to give the baby's name. Obviously, you know, if you've got a newborn, as Gloria was talking about, and if it's 8 days old, or if they
Right.
can't really determine the age, they may accept the baby within the spirit of the law. Maybe not adhering to that strict 7-day.
Right.
You know, they're not going to ask for a birth certificate, so to speak. How many days old is the baby? That would be accepted in the spirit of the law.
see.
But the goal is really to make sure that the mom or the dad, or whoever's bringing the baby, can do this without fear of prosecution, as long as the baby's unharmed, not neglected or abused. Of course, that raises a whole other question and issues to deal with. But as long as the baby's unharmed, to bring it to these locations, give it to a person confidentially, anonymously, as opposed to, unfortunately, putting the baby in a dumpster somewhere or doing harm to the baby. And you asked a little bit earlier, but does it have to be a last-minute decision? It does not have to be a last-minute decision. That woman can stay in touch with Safe Haven throughout her pregnancy. From the time she finds out she's pregnant, start calling the 1-800 number. It's 1-877, and Gloria's got it, 767-BABY.
Yes.
24 hours a day, again, multilingual, Spanish, English, Creole, other languages included. Find help for her from the minute she finds out she's pregnant till the time she decides whether to keep the baby or take it to a safe haven.
And that was good that you touched on that. You know, calling even Healthy Start Coalition is a great way to start, because maybe, you know, you guys have some advice. Maybe you have some insight on child care and you know, some other options that might be available. You know, it's not just
the first referral
avenue.
that number is going to give to you, the folks at Safe Haven, is going to be the Healthy Start numbers, because Nick works very closely and Safe Haven works very closely with Healthy Start across the state. So the first number they're going to say, do you know about Healthy Start in your area? Because Healthy Start does work with pregnant women and would know, hey, there are things out here in the community to help you, to raise this baby, to keep this baby if that's the choice you've made. But also our workers have gone through adoption counseling, so they know how to help moms understand their options. Right. So once the baby's placed, they may be asked, or taken to a Safe Haven location, they may be asked some medical questions. The mom can give it, or the dad or whoever can give as much or as little information as they're comfortable with. Then from there, the baby goes to the hospital to get medically evaluated to make sure that the baby's healthy, doesn't need any medical treatment. After that, then they'll be placed with an adoption agency, and a family who's been waiting for a baby will then have a family.
And
Yes.
I think it's important to note because I know I've heard the argument before, and I'm sure you've heard the argument, oh, well, this law is just making it easy for people to just abandon their children. But that's really not the spirit of the law. That's not what it's there for. It's to keep the children safe.
Yes.
And you know, a mother that knows that they're not going to be able to care for this child, this is kind of
an alternative.
Their last chance to make
Yes.
sure that this child is taken care
Mm-hmm.
of.
That's the goal, is to make sure there's not an unsafe abandonment.
Yes.
We know that, you know, this is going to be a small amount of moms that have to, you know, find themselves in this kind of situation where they have to make that decision.
Right.
But we want them to know that Safe Haven is here throughout their pregnancy to help them. And if that's what they choose for their baby, then they're safe, they're anonymous, confidential, without fear of being prosecuted if they
That's
make
great.
that decision.
Yeah, I mean, there's really, you know, there's no way to know what situation those mothers are in. There's no way to walk in their shoes, and you know, I think making sure that the baby is safe is such a gift.
Right.
You know, and what a difficult decision that must be, anyway. You know, no matter what the decision is, it's a difficult decision to make.
It is, and
Yes.
I mean, you really, you know, have to admire those moms who made that decision. I mean, we've had 5 babies placed through Safe Haven in Polk County. There were 2 in 2007, one in Lake Wales at a fire rescue station and one in Lakeland. And there was a lot of media coverage on the mom in Lakeland who had the baby, I think at a fast food restaurant in the bathroom, and then walked the baby to the fire rescue station. And she knew all along that that was the right decision for her. And, you know, we admire her courage and her carrying that baby and having that baby under those kind of circumstances, and then making the choice to make sure that baby was safe. So it's not the right choice for every mom,
Right.
you know, for her, but we do want women to know that this is one of their options if they find themselves faced with that kind of decision.
Now, you all have a big event coming up, kind of an awareness event. Tell us a little bit about what's going on.
Right. We, on November 13th at 11:30 a.m., in partnership and with leadership from Polk County Commissioner George Lindsay, and with partnership from the Board of County Commissioners Communications Office, with the support and help from staff here, we're having a media luncheon. Again, it's Wednesday, November 13th at 11:30 a.m. at the Jim Miles Professional Center, which is just across from that new public shopping center on US 98 in Highland City. So we're really hoping to get some excellent media coverage to make sure that Polk County knows Safe Haven is a resource, that
Right.
we don't have to have babies abandoned or harmed.
Excellent.
So we appreciate your help in getting the word out.
Well,
Yes.
I'm glad to have you guys on, and so thankful for the work that you guys do at Healthy Start, and all the great services that you provide to the women and babies, and keep up the good work.
Thank you.
Thank you, we appreciate it.
That's the Healthy Start Coalition, talking about the Safe Haven for Babies. It's a law that's enacted. It's a program here in Polk County that is there to keep babies safe, that is there to make a way for mothers who feel like there is no other way. So listen, if you're watching this and you're thinking, I'm in this situation, I don't know what to do, you can call Safe Haven at 1-877-767-2229. So it's 1-877-767-BABY. Or you can contact Safe Haven for Newborns at asafehavenfornewborns.com, or Healthy Start. You can get a hold of them. They've got a lot of great services and wisdom available for you at healthystarthhp.org. They're having their big media event on Wednesday, November 13th at 11:30 a.m. at the Jim Miles Center, located at 5204 US 98 South in Lakeland.